Please, ladies and gentlemen, we're still waiting for the Honor Minister. He will join us shortly, please. Thank you very much. Please, Professor Hajara, you're welcome. Kindly mute your on speaker, please. You're welcome. Please, Hakim Dixon, please, you should mute your on the computer, please. Thank you. We are waiting for the Honor Minister. The meeting is streaming live on YouTube now. We will soon start. Thank you.
Somebody collected my thing. No. Olatunde Basi.
Doctor. Yo, boss, please kindly mute your laptop, please. Go on again.
Network.
Mr. Thomas Ochimana, you are welcome. You are welcome, Ochimana. You are welcome. Please, we're waiting for the Honourable Minister. Please, you are all welcome, please. You are all welcome. Please, we are waiting for the Honourable Minister to start the program. Thank you, Madam. Thank you, Madam Kucheli.
Vanessa. Hello.
You are welcome, Madam Kucheli. Please kindly unmute your own laptop, please. You are welcome. We are seeing you. We are waiting for the Honourable Minister to start. Thank you. Yes, we are seeing you.
Okay, but I just want to do on Okay, so soon chile kana na gani na ko? Asun chile inda bara gani ba ko?
Please, ladies and gentlemen, please, we are still waiting for the Honourable Minister. Please, we are tendering our unreserved apology. There is a little, the Honourable Minister is online, please. The Honourable Minister is online.
Hello.
Honourable Minister, sir, you are welcome.
Yes.
Honourable Minister is connecting to the audio.
Hello.
Honourable Minister is connecting to the audio.
Okay, then.
All right. You need to adjust.
I'll take over. Yeah.
You need to adjust your sitting where camera is not actually capturing you.
Come. This is not capturing me.
Yes, you are not.
I'm there. You are not seeing me?
Yes, we are not.
They saw me. You say they are not
to
seeing me at the background.
Yes. You need to come forward or take the laptop down.
Don't worry.
Thank you, sir. You have the floor, please. Thank you very much.
Okay. Oh, but I'm better now. I want to welcome everybody. I must say a very good afternoon to all of us here. This is a very important program organized by the Federal Ministry of Health, the Department of Traditional and Complementary Alternative Medicine, in collaboration with the System and Care, the Geriatrics Unit of the Family Health. I am sure this is the first time we are organizing such a program. And you must have in mind that the aged are people. We all pray to get to the old age. But to get there, we need to ensure that we are in a good quality of health, like we would say, both physically, mentally, spiritually, and even otherwise. So we are happy to welcome all of you on this two-day webinar program, starting today, and also we have at the concluding part tomorrow. Not to waste much of our time, you will be given presentations by different experts who are qualified to talk about what the aged needs to do to ensure good quality of life. We have speakers for today. We have 3 distinguished speakers. One of the speakers is going to join us from Sierra Leone. By name, Dr. Kojo A. Kario. He's a consultant family physician. He's the chair and president of Integrative Medicine West Africa. He's a certified trainer and examiner of the West African College of Physicians and member of the Strategic Plan Monitoring and Implementation Committee. He is also the former vice president of the Sierra Leone Medical and Dental Association, chairman of the Ethics and Disciplinary Committee of the Sierra Leone Medical and Dental Council. We are happy, and I hope he's with us. Let us see him. Dr. Kojo Karo, you are welcome. Can we see you? Just give us. Dr. Kojo, is he online?
Yes, I'm here.
Okay, say hello to everybody. Yeah,
hello to
Dr.
you all.
Thank you. Welcome, Doctor.
We are all one people.
Thank you, Dr. Kojo. We're happy to see you. How is Sierra Leone?
Oh, Sierra Leone is fine. We are now seeing a lot of COVID patients.
Oh, that is serious. So this program is very timely. You are going to tell us how the aged can be managed in circumstances like this. Another speaker is Dr. John To Abide. Dr. John is a veterinary surgeon and neurotoxicologist.
In charge of Tcam.
He's the founder and CEO of In-Country Medical Care Limited, Integrative Medicine Center, Abuja. He's also a former study director and senior scientist, Novartis Pharmaceuticals. He's also a research scientist, Center for Research on Occupational and Environmental.
Hello, it looks like there's a little technical problem. Please, phone, please, should be back shortly.
Okay, am I, Dr. Said, how far? How far now?
Yes, we are with you. We are with you,
Okay.
Director.
Okay.
Yes.
Thank you very much. Like I was talking about, one of the speakers for today's session, Dr. John To Abide. I said that he's a veterinary surgeon and neurotoxicologist. He's a former study director and senior scientist, Novartis Pharmaceuticals. He's a research fellow, U.S. Food and Drug Administration. He's the Secretary General of Integrative Medicine West Africa and coordinator of Committee on Ozone Therapy. I am sure, I hope Dr. John is on with us. Can we just say hello to you, Dr. John?
Very much around.
Okay, good to see you. Say hello to everybody. Thank you.
Hello, hello. Yeah.
Thank you. And the third speaker for today's session is pharmacist Stella Osinobu. Having been in the practice of pharmacy for 35 years, she is also a fellow of the West African Postgraduate College of Pharmacy and a master's in public health. She has practiced community pharmacies, both public pharmacy too, and she's one of the pioneer staff of pharmacy department at the National Hospital, where she constantly sees the aged people. So she's in a both position practically to tell you more about the aged. This is just for today, just to give you a view of the activity for today. And I want to, once again, I noticed there are some distinguished people. Maybe I will give Dr. Saidu some minutes just to say hello to them and recognize those who have joined us to join this program. Dr. Saidu, over to you.
Well, Ma, I think because of the issue of time, Ma,
Hello.
it's just we just acknowledge the Honourable Minister and the former Minister of Human Affairs, Josephine Leni, and the Senator Eze, the President of the Court of Nigeria, and we have the co-chair of the SGA Africa and the Executive Director of Mokaro Foundation. These are the two invited guests that are going to be with us today. And you are all welcome, other participants and colleagues on this very important occasion. I'm Dr. Said Muhammad. I'm the National Project Coordinator of Healthcare for the AIDS in the Federal Ministry of Health. Thank you very much. You are welcome, Honourable Minister, sir, and Senator Distinguished and the former Honourable Minister.
Thank you very much, Dr. Saidu, for that brief message there. I want to call on the two invited guests to give their goodwill message. The Executive Director of the Foundation, Omokara Foundation. Is she with us?
The President.
Yes, I am here.
Oh, President, forgive me. Okay. All right, good to see you.
Thank you very much. Let me thank the organizers of this webinar, Federal Ministry of Health, and in fact, HEPIQ-C team. Thank you very much for the honor. I bring you this goodwill message on behalf of the Dave Omokoro Foundation, Gerontology Association of Nigeria, and the stakeholder group of Africa. We are a coalition of multidisciplinary, multi-sectoral experts in aging, building capacity, promoting research and data production, and influencing policy and programs in collaboration with government ministries and agencies on behalf of the constituents of older persons. Wish to appreciate the Honorable Minister of Health and the entire team in the Federal Ministry of Health, and then of course HEPIQ-C for your good intentions of the gastric health using special purpose vehicle of HEPIQ-C. We have followed closely the Presidential Task Force task force on COVID-19. And then we see the commitment of the Federal Minister of Health with the ministers. And we really appreciate you for all that you're doing to save lives. And we also know that with you, we have seen that COVID-19 is now a magnifying lens to show the
No? There's a need for everybody to
older persons. And number two,
listen to her. Yes.
And number two, number one, significant
One really peak out.
Yes. I think you're up your page now.
No, she's speaking.
Hello, Aja.
Hello, there's a small technical hitch. We are trying to sort it out.
We are hearing you. We are hearing
I
you.
hope Omokaro has finished her speech.
She has done. She's done.
See your name, Daddy.
So thank you very much. And I wish to appreciate your comments. And the next speaker is the president of the AGET.
No, president of the coalition, the right of
coalition.
Yes, the president of cost swapping, Senator Eze Ojoko.
Okay. Is he with us?
Yes, I'm with you. You can see my hands?
Yes, oh, great, Senator.
Thank you.
Over to you.
The chairman of this occasion, the distinguished Senator Dr. Adeleke Olumbe Mamora, the Minister of State, whom I have known to be a people-oriented person, want to thank you for this privilege to say something in form of goodwill here on behalf of the Coalition of Societies for the Right of Older Persons, which is a coalition of all groups working with aging in Nigeria. We want to thank the Federal Ministry of Health, especially the National Coordinator of HEPIQ and Tcam, for organizing this two-day webinar on Nigeria response to healthcare for the aged. As an older person myself, I see this focus as a welcome additional approach to the provisions of healthcare to older persons. The role of traditional, complementary, and alternative medicines in Nigeria cannot be overemphasized. Those of us who were born in the 40s know only about traditional, complementary, and alternative therapies. They offer treatment for all ailments and are still effective in our rural areas. We know that the foundation and source of modern pharmaceutical drugs are from our herbs, roots, stems, and fruits. I can say that the white man, not wanting to accept the efficacy of our traditional therapies as they were, encapsulated them to offer them back to us, claiming that they are superior. Cost swapping supports government efforts to include these therapies in the care of the elderly. On the response to health care of older persons, cost swapping is concerned seriously with their care and services. Today, I must say that we did not see much practical attention of government to the health care of the senior citizens who have been hearing of government programs but have not seen much on the ground to look after the older persons. The Coalition of Societies for the Right of Older Persons in Nigeria, whilst commending the ministry for this webinar and the Nigerian response to healthcare of the aged, calls on the ministry to fast-track all the already planned actions and the presidential directive on healthy aging. We recall that in October 2018, COSROPIN had its first national conference on aging in Abuja, highlighting issues and neglect of the older persons. We are glad when the Ministry of Health in December the same year followed up with the launch of the policy framework on healthy aging and at its national summit on aging in Nigeria. The policy framework was to support the achievement of universal health care coverage through creating a non-contributory health insurance scheme. Based on its framework, the health bill, I know, was approved by the president, who assured Nigerians that his administration is committed to improving the care of the vulnerable. The president's approval of 1% of the Consolidated Revenue Fund to deliver health care to the vulnerable gave COSROPIN great hope and relief that the older persons would soon be provided medical health insurance. Our understanding then was that 50% of the fund was to be given to the National Health Insurance Scheme to procure health services and insurance for the vulnerable. So by now, all Nigerians over 70 years are supposed to have been on national health insurance. COSROPIN, as the voice of the older persons in Nigeria, is worried and is asking what has happened to the presidential initiative. However, we are glad to note that on the 9th of March this year, before the pandemic, the Honorable Minister of Health, Dr. Osagie at the University of Benin, when it launched the Friendly Initiative, assured Nigerians that the ministry, as part of its effort to ensure the implementation of the presidential healthcare sector agenda, is currently reviewing the operational manual of the basic healthcare provisions to accommodate the provision of affordable health.
What is making it to stop? Huh? What's the problem? Professor Omo is here joining us.
Sorry, did you hear me?
Technical. Do we have a technical chief?
Did you hear me?
No. Yeah, you can quickly conclude, Senator Eze, please.
Okay. We want to appeal to the ministry to fast track all the already agreed planned actions and the presidential directive so that all Nigerians who are over 70 years can go onto the insurance, the health insurance, which has been promised us, and the minister has reiterated and reassured us that this will happen. We will be glad when, including what is being done today, when all senior citizens will be included in the national health insurance for the 70 and above. I want to congratulate the ministry for what is happening today, and we look forward to engaging with the ministry and continuing in our support for whatever the ministry is doing, but want to say as an older person that we are waiting for action so that the effect of this pandemic can be reduced on older persons if they have the health insurance that will cover them. Thank you very much for giving me the opportunity.
Thank you very much, Senator Eze Njoku, for that wonderful goodwill message. And we can see the passion there. And I'm telling you, the Ministry of Health is poised with all the relevant stakeholders to look into the issues raised. At this time, I need to recognize our Honorable Minister of State for Health, no other person than Senator Adeleke Mamora.
That is Sherif.
He's with us. Honorable Minister, sir, you are welcome. And it is time for you to give your speech, sir.
All right, thank you very much.
Honorable Minister, sir, welcome.
I'm sure you can hear me, right? Thank you very much.
You're on, sir.
I'm fond of referring to you as General Zena because of your passion for what you do. Let me welcome all the distinguished to this webinar. The speakers, the invited guests, and other participants, you are most welcome. And I must say that I am delighted with this historic webinar that has come at a time when all resources are needed to salvage the health and livelihood of our people devastated by the COVID-19 pandemic.
This guy should unmute all this.
More than ever before, this is a period when we need to explore our indigenous languages, alternative and complementary medicines to safeguard the lives of our citizens. The aging population in Nigeria is ever increasing, like in many other countries in the world. So also the demand for the care and support due to potential health problems associated with aging. Nigeria, being the most populous country in Africa and 7th in the world, with estimated 10 million older people of over 60 years of age, it is expected to increase by threefold by 2050, and consequently, it is not unexpected to have relatively more affected people with COVID-19. More so at the moment, the community transmission phase of COVID-19 is sadly ongoing, ravaging our vulnerable older persons, especially those with pre-existing comorbidities, which are significantly at higher risk of mortality. Government is deeply concerned about this. While we await the definitive solution to this pandemic, Nigeria needs to evaluate current best practice in respect of guidance for older persons' care during this period. We also need to develop a protocol for appropriate and person-centered treatment, especially for those with multiple morbidities. And we also need to harness policies that help strengthen our existing health facilities while developing the alternative, complementary, and traditional medicine. Nigeria's health development is predicated on the government intervention and to a certain extent by the private sector. Provision of health insurance for the older persons is most needed, but still not available. It is apt and timely that governments, and I mean at all levels, local, state, and federal, there is need for the various governments to get more committed about health care for older persons, especially at this pandemic period. The future health development strategies in Nigeria and most African countries amidst COVID-19 pandemic and after must accentuate alternative and complementary medicine sector in achieving universal healthcare coverage. As it tells itself in the wake of imminent Nigeria's and global economic recession that is gradually unfolding. The rapid spread of the COVID-19 virus and the measures implemented to stem the spread could have potential unintended consequences on health system and social inequalities. Exploring all avenues of intervention is very necessary, just like most of the Asian countries and that are embracing the traditional complementary and alternative medicine as a real-time alternative pathway to healthcare. Distinguished ladies and gentlemen, I urge you all, in the spirit of inclusiveness, to scale up your efforts and strengthen the measures to protect older persons and the threats faced by them in humanitarian settings, limited healthcare, food and supplements, and barriers to humanitarian assistance in form of adequate and balanced nutritious food that can exacerbate their risks during the COVID-19 pandemic. It is in this regard that Nigeria has developed national strategy on care for older persons that is all inclusive of all aspects of health and aging, aimed to address the threat posed by COVID-19 pandemic. We recognize that older persons make substantial contributions to sustainable development efforts through their experience and active, meaningful participation in the society. In that sense, it is imperative to fully empower older persons as autonomous and independent agents and beneficiaries of change, while harnessing maximally the natural endowment of nature for healthy aging. Finally, distinguished and gentlemen, as we are mindful in our response to COVID-19 for older persons, we must ensure participation of older people to be inclusive of their specific needs and access to life-saving treatment. We are committed through implementation of innovative collaboration of our sectors, departments, and projects to fully promote healthy aging of older persons and to mitigate the negative impacts during and after COVID-19 pandemic on their healthcare, lives, and well-being. We are also committed to promoting traditional, complementary, and alternative medicine in all ramifications for healthcare of our senior citizens. The Nigerian government will continue its partnership with all partners to strengthen targeted responses to address the healthcare needs of older persons and enable them to do the things they value for as long as possible in a bid to improve their functional ability and general well-being. I thank you for your kind attention.
Thank you, Honorable Minister. That is the speech. Honorable Minister said we are fully committed. The Ministry of Health is fully committed to ensure that there is promotion of healthy aging in older persons and to mitigate the negative impacts during and after the COVID-19 pandemic. So this is for all of us to recognize that the ministry is fully in support and fully ready to ensure that healthy aging is promoted and we take care of the aged in our society. We all know that you cannot buy age. Age has to be with what God has given you naturally. So we thank the Honorable Minister for his presentation. Before we go to the technical presentation by the three distinguished presenters, which I earlier on tried to give a bit of their resume, I want to welcome all of you again. I can see the increase in participation. We all welcome you to this program. Please ensure that you mute, please, so that you can listen to the presentations, please. And there should be no distraction. I notice some participants are making noise. Please don't do that for the benefit of those who are ready to listen, so that they can be at the end of this presentation. You have a lot to take home. So we are going to give each speaker 20 minutes. And after that presentation, we'll now try and take some simple, we discuss or take some questions and answer as fast as we can because time is not on our side. Okay, so we want to once again welcome everybody. The first presenter is Dr. John Tor Abide, who is going to talk about nutrition and immunity in the aged and also in COVID-19. Please, over to you, Dr. John. Your time, 20 minutes. Can you time him?
Okay, thank you very much, Haji Zainab, the director of Tcam.
Mr. John, you need to share your presentation, please. Share your screen. Share screen, please. You see a red green screen, share screen, can't leave.
Yeah, he's not, don't worry, let him. He has shared his presentation. Just leave him. Maybe he has shared it. It's okay. Carry on, Dr. John.
Thank you very much. I see. Mr. John, carry on, please. Mr. John, we're waiting for you. Hello, Mr. John.
Hello, can you hear me?
Yes.
Can you hear me?
Yes.
Can you hear me? You can hear me now?
Yes.
Okay, thank you very much. I had earlier given my, vote of nice Pharmacist Zainab and then the Honorable Minister of State. My presentation is going to be on nutrition and immunity in COVID-19, and particularly as it affects, the aged. Let me make this very clear. Let's look at immunity. Talking about immunity, these days everybody is talking about immunity. Immunity is really everything. I say that if you look at our body, the immunity is actually the chief of defense. Because if you have a good immunity, you are prone to be protected against, diseases. So it is very important for us to understand briefly what immunity is. You have two aspects of, immunity. There is what we call the innate immunity. That is the one that we actually inherited. It is with us. And then the second aspect of immunity is that is adaptive immunity. Adaptive is the one that you live along with. So what really happens when the body gets, challenged with antigen, the first line of defense is actually the immunity that goes in, to attack the virus. And this is also known as the cell-mediated immunity. After that, this is supposed to be about 4 to 7 days. After that, then the adaptive immunity kicks. Tongo. Can you hear me? Dr. Saidu, are you still hearing me?
Yeah, we are hearing you, but we thought you are going to share the slide as people are seeing the slide.
Well, I think Pharmacist Zainab has already explained that to you. I forwarded, the slides. I shared it. Can I continue?
Please do.
Yeah. So I was talking about the two arms of immunity. The one that were born with innate, and then the one that it is adapted as we move along. So for the aged, it is really very important. In general, our immune system tends to wean down as we age. For example, one of the mediators of immune system is what is known as glutathione. Glutathione levels are known to be depleted over time. What is really happening in life and in general? We have 3 phases of life. The early phase of life is the phase of growth. We all grow in the ages from the time we are born up to 25 years. Once we attain 25 years, the rate of growth in our body and the rate of the breakdown is actually equal. And that is what you have, the middle phase of life. Or then up to 45, we start declining. This is a general trend. And we start declining in good conditions. If we are living well and doing everything, we decline until our pH reaches about 6.4, thereabout. That's where man is supposed to die naturally. And those of you who are familiar with the other aspect, that's why we had only one Methuselah. So man is born to live and die. However, your lifestyle and the environment actually could accelerate how fast you go down. If you're not eating well, your immune system will certainly be challenged. If your lifestyle, you're not keeping with, exercise, you're not keeping well with, diet and other habits like sleeping very well, your immune system tends to be compromised even before you age. So in the moment you are challenged, as in the case of COVID-19, your body has less ability to really defend itself. We also know in this particular group of people that we are focusing our attention today, those are the aged. As the Honorable Minister also reminded us, and we all know these people have other comorbidities. Either they are diabetic patients already, even before COVID-19 came in, or they are hypertensive, or some of them even have cancer. So in such conditions, you see that the immune system is already compromised. That's why they first of all came down with the disease. So,
I can't hear you. I wish to join in the conversation, but I cannot hear anybody. And the discussion, so I can't follow the discussion. But the only thing I can say is that I have a 90-year-old mother, and at that age, they don't really need.
I think the presentation is actually going on, and I've been given particular time. Dr. Saidu, can you intervene, please?
Thank you very much, Dr. John. You know, the presentation is for 20 minutes, and it's important to be also to be precise and clear to people, so that when you finish, they'll be able to actually ask questions and also discuss exhaustively, to have a very good, robust discussion to enable us actually get something from you. So for all participants, please, let's allow the presenter finish his own presentation. If you have a technical issues, please kindly chat so that the host can actually address your own problem. Thank you very much. Dr. John, please, if you are alone, kindly remove your glasses so that people will see who you are, please.
Well,
if you are alone.
I'm being cautious, but I have no problem doing that. I've actually removed it. What I've done is to give you a brief background. Since we're talking about integrative medicine or traditional complementary medicine, let me go ahead and tell you briefly the kind of the fundamentals of integrative medicine. Well, what we do in integrative medicine that ensure proper health, and this is very important to the aged too, we normally detoxify. Then after that, we do what we call cell membrane stabilization. This is where things like omega-3 comes in, because omega-3 composes a very good proportion of our cell membrane. And we come to know this day that the cell membrane is actually the intelligence center of the cell. Then we do intravenous, infusion. That aspect of intravenous infusion is really very important, because in disease state, the demand for these micronutrients is really very high. So if we depend on oral infusion, in specific examples, you see that the body cannot really meet up with, the deficiency that resulted in disease, first of all. So those are classically the fundamentals of integrative medicine, or what we use in alternative and complementary, medicine. So let me go ahead to see. We all know that nutrition actually drives our immune system. And in COVID-19 in particular, the ages that are faced with certain challenges, apart from the immunocompromisation, COVID-19 patients are faced with the difficulty of oxygen.
No, don't worry. I'll go and I'll tell you. I won't.
Recall that nutrition gives the immune system its firing power. In this regard, we must look at nutritional supplement in COVID-19 in terms of appropriate doses. There are several stages of COVID-19. Those who are classified as asymptomatics, those are those that are not showing the symptoms of the disease. Then you have those that are classified as early or mid-symptomatic. Then these are the moderate patients. Then you have those who are severely showing symptoms, or the symptoms of the disease, and who will gravitate into the intensive care unit, ICU, intensive care. So it is important that you take note of the right doses of the vitamins or supplement that you give. I'll give an example with vitamin D and then vitamin C, which are typically used as adjunct in management of COVID-19 patients. So in general, the case modalities in COVID-19 are skewed in the age. So this is to say that the age are those that we've seen. And when we say the age, these are people who are 60 plus. They are the ones that we see most of the mortalities that have been reported or associated with COVID-19 patients is skewed towards this population. So we know that the immune system tends to age, wane. New findings have actually confirmed the efficacy of dietary vitamin supplements, including vitamin C and D, as I said earlier. So vitamin C, vitamin D, zinc, and omega-3 fatty acids are found in fish. But in critical condition, as I've said, it is recommended that we use very high, doses. There is a professor, Professor Combat, who is a professor of biochemistry at Oregon State University. I happen to have finished from Oregon State University. He's one of the leaders in this work that vitamin C can actually help in ameliorating the effect of COVID-19. The importance is this: if we are taking adequate, supplement, our immune system is up, it can hold us from gravitating to either the severe stage or even to the intensive care units. People whose immunity system is well boosted because of adequate supplementation, you see that even if they are affected with COVID-19, they are less likely to gravitate to the intensive care unit, phase. So that is, the emphasis. Now, I would like to give you some practical, demonstrations or discussions on things that we are doing here at our center.
Hello? Hello? Dr. John, you only have 6 more minutes to go, but something is happening. Are we back?
We are hearing you, Hajia.
Dr. John has 6 more minutes to go. Carry on.
Hello, Dr. Joe, we are waiting for you.
Hello.
Okay, I must apologize. We actually had a pause on that. We had some technical problems. So let me go ahead. In summary,
Dr. John, please, you have 4 minutes left, please. We have 4 minutes left, please, to actually go to the second speaker. Kindly summarize. Thank you.
Well, thank you very much. And that is what I'm actually moving on to. So in summary, supplements are very important as agents in our immune system. Taking example, vitamin D. There is a list of supplements that is commonly used in the management of COVID-19. You have vitamin D, you have vitamin C, you have zinc, you have melatonin, you have CoQ10, you have selenium, you have quercetin, then you have thiamine. But the warning here or the advice is here, don't just go and start taking these vitamins. You need the advice of the medical doctor, the people who can determine what phase of the disease you are so that you are taking the right amount. So at our center here, what we've done, because of the overwhelming need when we are in disease state, we do mainly intravenous high dose vitamin infusion. Take for example, vitamin D. Majority of us, especially the Black people, who are deficient in vitamin D. The normal dose of vitamin D that is usually recommended, we should not have less than 70 milligrams per meal. And you see most people that come to us here, some of them are below 20. So how do you really boost the level to 70 to 90 if you are just dependent on oral dosing? So intravenous supplementation is very important. Such patients, such people that come with very low doses, take for example, we give them 600,000 international units of vitamin D, and that is enough to really boost your time within a period of 3 months, where we would reevaluate and see if you come to the right level. We have
Thank you, Dr. John. Thank you, Dr. John. Your time is up. I'm sure there'll be some questions for you when during the answer time. Dr. John has given a summary of what is important to understanding immunity and then the nutrition. But I know as we go along, what we would want to know, in addition to what Dr. John has said, is that, you know, we talk about traditional, complementary, and alternative medicine. We would want to know, what can our people eat? The aged have been there for years. They know those traditional foods. We should be able to emphasize on the traditional foods for the benefit, so that it can help to give them quality of life, what they have. And also, before going on any supplementation, it's good to contact the experts, just like what Dr. John has said. So I want to go to the next presenter, Dr. Ayodele Koja from Sierra Leone. Over to you, 20 minutes. Please, everybody should stop interrupting during presentation. It's very important so that people can get the message. Thank you. Over to Dr. Koja.
Yes, good afternoon, everybody. I want to thank the dynamic from Zainab Sharif for inviting me to take part in this very important, webinar discussion on the aged. Like the minister said, we are all getting there, and we have to be prepared. And I want to share what the minister's concern. His concern actually, is in this the devastation of COVID-19. And I think we rested, the anxieties in our last meeting with the ministerial team of the federal ministerial team of Nigeria. That's about 2 or 3 weeks ago. But I think I should start my own discussion now on the aged. Now, before we start talking about this topic, what is aging? It's just a process of maturation. You become mature, and it is fraught with a lot of physiologic problems, physiologic and pathologic problems. Now, we have to know that, according to research, the tipping point of aging is 33 days after your 35th birthday. So 35 years plus 33 days. Then the skin, normally it is gauged with the elasticity of the skin. So that's just purely academic. So let us know that the tipping point in aging is after 35 years of age, and is 33 days after your 35th birthday. Now, we are talking about life. What is life? Life is all about energy, because energy is needed to drive all the life processes. And the life processes are what we were taught in biology and in medicine. All the life processes are what we refer to as metabolism. So all metabolic processes need energy. So energy is central to life. So in that regard, all living cells, the unit of life is the cell. All living cells generate their own energy, and the amount depends on their function. the nerve and cardiac cells are very high energy cells. And let me tickle your knowledge a bit. Structure within the cell that produces energy is the mitochondrium. And we have to know that in the high energy cells, like the nerve and cardiac cells, you have between 8,000 to 15,000 mitochondria per cell. That is how profound it is. So, but now, so for us to understand disease and aging, we have to know that with disease and aging, the energy level goes, drops down. So anything that reduces this energy slows down metabolism and is actually the main reason for disease and aging. Toxins directly affect our cells. And it affects our cellular production of energy because the toxins attack our energy production mechanism. That is, they attack the mitochondria. And one author famously says that we develop what we call mitochondrial decay. Now, we know that toxins, okay, that's the reduction in cellular energy and the attack by toxins is why the first sign of sickness or disease is weakness, tiredness, and lethargy. Those are the first signs of disease. Toxins can be from outside invaders, like the drug medication that are given to, so we have to beware. Infections can cause the production of toxins, and viruses are direct toxins because they are particles, they are not living organisms. Let us get that clear. Viruses are not living organisms, they are just noxious particles, and they can be used to, to damage, and they can be used to even positive effects in some instances, but in most instances they're damaging. Of course, we have non-toxic viruses. So as I said, toxins can be from outside, from the drugs we take, due to infections, viral as well as bacterial, from the cosmetics we put on our bodies, the drinks we take, the foods, the additives that they put on foods. All of these things bear toxins. Even the air we breathe contains a lot of toxins in some areas, especially in our urban areas where we have high toxic levels of different forms. Our rural areas are usually spared. So it's better to live in the rural area as we age. I mean, most people in Nigeria, I see, return back to their villages when they retire. That's a very, very good move. And toxins can also be from the body's waste products, which need to be excreted. So we excrete those toxic materials that the body make during its metabolic processes. So, and we excrete them in our guts, and it comes out in our excreta, in our stools, and in the urine, and in the sweat. And interestingly, we also excrete from our lungs. We breathe out gaseous excreta from our lungs. That is why I look at this thing about wearing masks. When we rebreathe, the excreta from the lungs, when we apply the mask. There are some clever masks that, you have the inhalation port and the exhalation port. but those are very huge masks that are used in bigger disasters. Okay, I am just stimulating you for more discussion. Now, we age faster when exposed to toxins for prolonged periods. I'm saying this now. Let us wait for the aftermath of COVID. We will see a lot of distressing situations because COVID causes diffuse inflammation of all structures in our bodies, and it will lead to the development of a myriad of chronic diseases, and this will impact on the aging of our populations. I said this quite a few, about 2 months ago about COVID, that this will happen. And it's just a few days that they are saying this in the news. Now, complementary and alternative medicine techniques applied by Integrative Medicine West Africa is the way to go to slow down this process of aging by maintaining wellness and preventing sickness. So we do two things. We maintain wellness and we prevent sickness. I will give you an example of a typical situation that we all will can bear down on. Now, it is sickle cell. This is a story of sickle cell disease. In brief, we applied this complementary and alternative medicine therapy with our ozone protocol to patients with sickle cell crisis, and it aborts it consistently in less than 4 minutes. And it improves the quality of life of sicklers by enabling them to carry out normal life functions. That is, they go to school without any problems. They go to work without any problems. They are regular in their work. They are regular at school. So they perform, their performance goes up and their quality of life goes up. So the question is, what is this ozone? Now, ozone is one of the superoxygen species. And it is O3, whereas oxygen is O2. So we have other superoxygen species like O4, O8, O16, O32, and O64. But the higher you go, the more unstable the molecule is. So ozone is more stable than the other higher levels of the oxygen species, but then it is not as stable as oxygen itself. And it has a half-life, and it does not have any shelf value. That is why there is no interest in it. And it has been used. It was discovered over 200 years ago by Christian Schonbein in Baden-Baden, and it has been applied in medicine and in dentistry for over 110 years. And it is surprising that we don't know much about it. Now I think I've talked about that. So with this complementary and alternative medicine therapy applied by INWA, we can reverse the pain in arthritis, which is a common feature in the elderly, and we can bring about repair of joints. That's fantastic, because when patients have arthritis and they're given steroids into the joint, they inject the joints with steroids. The steroids damage the joints and also suppress your immune system, whereas ozone does the opposite. Ozone elevates your immune system. It modulates your immune system. It encourages the regrowth of your cartilage on the joint surfaces. It stimulates their growth. That is fantastic. And with this complementary and alternative medicine therapy, which is applied by IMWA, we can also improve the function of all internal organs, the heart, the brain. We have reversed patients with Alzheimer's with these therapies. The liver, we have improved liver function in a lot of patients with disease. Kidneys, we have reversed kidney insufficiency. The pancreas, ovaries, we have shrunk ovarian cysts using this complementary alternative medicine method. The prostate, the eyes, we reduce glaucoma in a very short time, within 5 to 7 days, regardless of the eye pressure, we reduce that, and there is nothing medical that can match our therapies. We also have successes with some cancers. We have reversed chronic lymphatic leukemia in 5 months, just using complementary alternative medicine therapies. Now, the question will always arise. Number one, what is the toxicity? Now, ozone has no known toxicity. Sorry, it has no known side effects. Its toxicity is 0.00007, which is, there is no medicine made by man that is this safe. I would like to stop here and maybe, okay, let me digress a bit on what the minister is very much concerned about, is COVID-19. Now, we have proven that to beat COVID-19, you have to be COVID ready.
Dr. Kojo, you have 5 minutes to go.
Yes, fine. Thank you very much. So to be COVID ready, it means that you have to be able to beat the transmission of the disease. So we've been able to break the transmission of the COVID instantly recognition technique that we developed 6 years ago during Ebola. And because we developed that technique, none of our staff or workers came down with the disease. And likewise, we are running a full hospital, and none of our staff have come down with any symptoms of COVID since our first patient in March. So that is evidence enough, because a lot of doctors, I'm sure, will be asking, what about the, do you have any trials? Do you have any days? But COVID has just come to us. We don't have any, we only have evidence, and medicine is evidence-based. So I thank you all for listening.
Thank you, Dr. Kojo, for that wonderful presentation. We really appreciate his presentation. But just to add to what he has said, because it's important to recognize complementary and alternative medicine is very diverse. There are a lot of areas in complementary and alternative medicine which I think our people would want to have just an insight. For me, I felt I should quickly mention this. Aromatherapy is an alternative medicine. And when we mean by aromatherapy, we talk about use of essential oils, because I know it is very customary for our people, especially the aged, to use a lot of things like aboniki, shea butter, eucalyptus oil. These are things that is a gift to the aged people, especially if you remember, in those days, that's my gift to my father. I always make sure there is aboniki, shea butter, because they'll be feeling that they need those things. And that combines it with what we call massage therapy. So aromatherapy with massage is important. The aged should always have in their rooms this aboniki, shea butter, and eucalyptus oil, especially during this period now. And then I'm sure hydrotherapy is also recognized as part of complementary and alternative medicine. Hydrotherapy is the use of water for ailments. At times you need to use hot water or cold water. Dr. Kojo talked about arthritis, which is something very peculiar, the wear and tear of the joints. At times you need to do some small hydrotherapy. And I like to look at the traditional angle locally. Our people, they often take the shea butter, boil it with some ginger and a pinch of cayenne, the pepper, gradually at a slow heat. So you are able to come out with something like what we called the liliment of those days. Liliment, and I'm sure this, when we use traditionally in the local villages, they take the shea butter, put some ginger, put some cloves, put some cayenne. They are able to gradually, at a very low heat, boil this preparation, and at the end, decant or sieve the oil from the paper, from those other ingredients I've mentioned. And I'm sure these are things our local people use at the villages. That brings me to the area of acupuncture too, which is a form of complementary medicine. I'm sure some of the aged who are with us must have used acupuncture. The Chinese are there, and then they do give acupuncture points. So when there is opportunity, because like I said, complementary medicine is very big and diverse, necessarily we can look for acupuncture points. And you must forget that experts too of homeopathy. Homeopathy will come in and talk to you about what you need to do in the area. And there are chiropractic doctors. Chiropractic doctors are the ones that look at your bones, be able to see if there's any problem. We have some of them experts too that are in Nigeria. Dr. Ogun is a chiropractic doctor. And where there are challenges with areas of bones and muscles and nerve issue, especially when people do have spondylitis or sciatic problem, sciatic nerve, and experts like that can be able to assist you. Of course, I just felt that there is so much more about complementary, because it is simply defined as any other method of taking care of your health that is not traditional or orthodox. And emphasis have been placed on ozone, and because it's a clean one, and there's a need for us in this country to try and see what is the benefit of ozone. We always like, because of our conservative nature, not to try new things. Ozone is we recommend it if we provide it, you only go to the experts who are qualified to carry out. And I think this is very important, especially as we look at COVID-19, and we know the aged can easily be prone to any of these diseases. So although I'm going to give my lecture tomorrow on herbal medicine, but I felt that this area of complementary medicine should be mentioned, because I like to be very practical, especially with what our people use. They can get access to in the villages. They can also get them around them. Thank you. I would want to call the next speaker. For every aged person who is sick, who is either has a comorbidity disease, you may be hypertensive, you may be diabetic, you may have cancer, you may have ulcer. So you are easily prone to any of these diseases, and we know that your immunity can be compromised. Well, what happens is that the aged, most of our aged people, they reach a time they don't want to take their medications. This is not right. You see, some people will not want, you have to take the extra mile. The caregiver has to make sure that either your granny or your father or your mother take those medications. That is the aspect we call pharmaceutical care. When the medications are there, it's important that we take the medications. And then we take the complementary and alternative aspect for maintenance therapy. So I will call on pharmacist Osunubu to talk about pharmaceutical care. Thank you. Over to you. Isn't it? I think it was a good one. People are smiling.
So, okay. So there are several. Okay. There are, the pharmaceutical care of aged patients need to be individualized due to the following factors. Some of them have been mentioned by the speakers that people that spoke earlier, so I'll not dwell much on them. Comorbidities. I'll talk about polypharmacy. Polypharmacy, we find that elderly people, they tend to take a lot of drugs and from a lot of sources. They patronize so many different kind of health providers. They patronize, and so there's a lot of drugs and medications being taken. And then you find that the nature of the chronic conditions in aged patients also requires multiple therapy for control. And so you find that the number of medication increases. So you can have, in aged people, the issue of comorbidity. You have somebody suffering from hypertension, diabetes, and then he's taking so many and pharmacokinetic variations. You find that as people get older, organ systems change, and this affects absorption, distribution, metabolism, and elimination of drugs. The effects, they are particularly significant in elderly patients. These include effects on the brain and digestive system, cardiovascular system. Okay. Okay. So you find that the elderly patients, they are also vulnerable to sedative effects of psychotropic drugs, resulting in an increased risk of falls and hip fracture. And then they tend to experience discomfort, pain, and difficulty swallowing medication. Some of them, it's a problem many of them face. Then we talk of non-adherence. elderly patients can have some diseases that make adherence to drug therapy difficult, such as conditions that affect vision. We talk of macular degeneration and cataract formation. This makes reading of prescription labels and medication instructions difficult. Hearing loss also affects understanding of health professionals' instructions and medication information. So you have other factors being non-adherence, depression, and memory loss. So for the pharmaceutical to take care of them, pharmaceutically, the pharmaceutical care plan, we have to draw up an individual plan for each patient based on the comorbidities, based on his previous experience with drugs, and based on a lot of other factors. So first thing, we have to establish the database. Then we have to look at the medical care plan before we draw up our own pharmacy care plan. And from there, we do the interventions that we're seeing from the therapy. And then we monitor, we reassess, and we upgrade each time there are changes, either for better or for worse. So in establishing the database, we talk about the patient demographics, the age, the sex, ethnicity, height, weight, lean body weight. All those have to be included. Then the history of the patient, the present illness, the past medical history. We have to know it. Has the present medical problems been treated with drugs previously? What's the outcome? Is there anything in the history to suggest a contraindication to the drug therapy, or anything that will affect the drug's action or effectiveness? Then we have to look at the medication history. What medications the patient has been on, and has it been effective? Is there any need to change anything? Is there any need to remove anything? Is there any drug that is countering the effect of other drugs? We have to look at all that. Then we also have to look at the allergies and adverse drug reaction. Has any allergic reaction occurred in the past? What is the nature and significance of past allergic reactions? Do potential allergies exist? Like, is the patient allergic to some kind of foods? And is there any evidence that the patient cannot tolerate a medication in the past? You find some patients abandon some medications because of ADRs, side effects, and they just stop taking it. Okay. And we also look at the smoking and alcohol drug abuse history. Can this patient's history affect drug absorption, distribution, metabolism, or elimination? Or does it contribute to the patient's medical problems? Like smoking, we all know the kind of harmful effects it has on the body. Then compliance history. Do past therapeutic failures suggest a lack of adherence to drug regimens? The social history, the living conditions, and physical limitations. How does it affect the patient's compliance? How reliable is the source of information? And sometimes the patient may be responsible for his or her own drug issues. And then what is the understanding of the patient's instructions for taking the drugs? So all this we have to look at for in drawing up the care plan. Then we have to assess the pharmacotherapy. We have to relate all the drugs that have been ordered for the patient with the list of his or her medical problems. And we need to review the medication history to help identify drugs that the patient was on prior to admission and which the patient should continue to receive. So we have to look at each drug and find out, is this drug, is it justified? Is there therapeutic duplication? Is this drug of choice is this the drug of choice for this particular patient? And what are the alternatives, therapeutic alternatives? And of course, the cost effectiveness, because if the drugs are too expensive, the patient will not be able, some patients may not be able to afford them, and then he begins to default, he doesn't comply, okay? So we also look at the dosage. Is this dosage weight, is it adjusted for the patient's weight? Especially that reduced because of the reduction in volume of distribution and a lot of other factors. Then what side effects are possible? And are any of these more likely to occur in this patient? And then are there any clinically significant interactions? Because when a patient takes several drugs, there are likely to be drug interactions. So all these have to be scrutinized for the aged patients. So we have to identify the specific problems, drug-related problem. Is there a wrong drug? Is there too little of the correct drug prescribed? Is there too much of the correct drug prescribed? Is the medical condition being caused by adverse drug reaction? Is it caused by any type of interaction? And is it caused by lack of drug prescribed? Or is it caused by inappropriate drug therapy? Maybe there is no valid indication for the drug that is being taken. Then when we have done all this, we identify the parameters. For example, a hypertensive patient or somebody that has a comorbidity, hypertension and diabetes, you want to look at the monitoring parameters, the blood pressure, you want to look at the blood sugar level, and then you want to check as these drugs are being taken, is this blood pressure, is it being controlled? Is the blood sugar being controlled? Do we need to add another drug? Is the patient reacting to this drug? Is it the best drug this patient can use? So when we have done all that, then we have to make our interventions, and then considering the risk and benefits of all therapeutic alternatives for each problem in this patient, what drug regimen do we institute? What changes do we need to make in the existing drug therapy? Do we need to add, delete, change drugs? And of course, all this is done in collaboration with the other healthcare providers and to get the best effect for the aged patients. So, and we need to make the interventions gradually. As we make the interventions, you discuss with the prescriber, and if there are any changes done, we are also going to assess and see if these changes are, the patient has a better result with them. Okay, so there were interventions, and then we have to reassess what we have done over and over again and make sure that we are getting the results that we require. So the database, the Medicare plan, we review them on a regular basis. We also revise our pharmacy care plan to make sure that this patient, this our aged patient, is getting the best therapy, is not suffering any ADRs, is not suffering any side effects, is complying with the dosage regimen. So I'll now talk about the benefits. These are just some few benefits of pharmaceutical care in aged patients. You can get drug compliance and adherence, and it leads to improved therapeutic outcomes. A lot of times, the aged people, especially those that didn't have the privilege of being educated, don't understand drug instructions. Sometimes when they are being spoken to in a language they don't understand very well, they don't know how to use their drugs properly. So from this pharmaceutical care, we get compliance and adherence. Then there's a reduction in adverse events and drug interactions. Then there's also the reduced cost of therapy. Yes, and this has been found to be very, very helpful for patients who are a bit on the indigent side. And all the long-term effect of all this is that there's increased longevity and improved quality of life. Thank you. Thank you for listening.
Thank you very much, Pharmacist Sustainable, for that wonderful presentation. It is very important that there is a care for the patient, especially the elderly, to ensure proper use of medications. Thank you very much. We need to appreciate all our three presenters. We thank them for the wonderful presentation. And it is now time for discussions, questions, and answers. This must be done with care, please. We don't have so many people speaking at the same time. Okay? We'll look at where they are raising their hands. Check. Put your hands up. You go to where they go. Check. Let's go. Yeah. There's the way you see. Have you seen?
No, they are working on it.
Can you see their hands? Put up the music. Okay. Dr. Ogugo or Ogu, please, sorry, my dear apology.
Thank you. Thank you, Madam Moderator.
Okay.
I'm really glad that this webinar is holding. I've enjoyed all the presentations. I'm a geriatrician with the National Hospital Abuja, and this is a topic very dear to me because the older adults are very special to me. So first observation or comment that I would like to make is yeah, so somebody had muted me there, sorry. So I would like us all to try and embrace the term older persons, older adults, rather than the use of the word aged. I've really enjoyed the discussion so far, and in geriatrics, we really embrace non-pharmacological interventions for a lot of chronic disease conditions in our older adults. As Dr. Keru has already mentioned, as we age, there's a lot of homeostatic constriction of functional capacity of major organs, the kidneys, the brain, the liver. So as people get older, we're very cautious about pharmacological dosing. So you don't get the same dose of a medication to a 70-year-old as you would to a 40-year-old. Like Mrs. Oshinobi also mentioned, there are those that we really cannot use pharmacological agents for. Those who have end-stage kidney disease or liver disease, we really try to shy away from certain drugs. So there's, some drugs we won't use in them. In geriatrics, we talk about the 5 M's of geriatrics. One of them is medication. We're very concerned that older adults are at risk of polypharmacy. Because they have multiple chronic conditions that require many medications. So and sometimes they have conditions that are secondary to the effect of drugs. So we do a great assessment, which is why I really enjoyed Mrs. Oshinobi's presentation, that you don't just plug in drugs. You need to do an adequate assessment to ensure that this new condition in this client is really not caused by a drug they had been given in the past. Really, really important. So we do what we call medication deprescribing, medication reconciliation. Very important in older adults. Coming to the issue of complementary and alternative medicine, again, I had said it before, we do embrace that in geriatrics for bone pain issues, sleep issues. There are lots of alternative and complementary medicine interventions that we embrace. I would, however, want to caution that we must, as we use these modalities, think about safety issues. So in orthodox medicine, we give you a drug, it is standardized, and we also monitor for adverse effects on the liver and the kidney. The same must be done when we start using alternative medicine where it is ingested, that we monitor for any adverse effects on the major organs, the liver, the kidney, as people use these interventions. So I would stop there just to give time to other participants. And I must thank the Honorable Minister, the leadership of the Federal Ministry of Health, Dr. Seidu, for putting this together. Really, really, really very useful. Thank you.
Thank you very much, Dr. Ogugwa. I really appreciate your comments, and we thank you for that wonderful presentation too. We have Okonwe Christian online. Is it?
Good evening, madam.
Okonwe? Forgive me,
Yeah.
Okay.
Yes, I'm Christian online.
Your name.
Okay, I have 2 questions. The first question goes to... Yes, I'm online.
Okay.
My first question goes to Mr. Kojo Kalio.
Okay.
During the lecture, he spoke about the use of supplements for the aged. Is he saying that supplement is better than natural foods for the aged? That's my first question.
He said what? Okay.
And then my second question.
Carry on.
Okay. My second question is this. How do you demystify the fear of COVID-19 among the aged in the rural areas, with special reference to non-accessibility to electronic media?
Okay. How do we demystify COVID-19?
The fear of COVID-19.
Fear.
Yeah.
Okay.
Among the aged in the rural areas, with special reference to non-availability of electronic media.
Okay, thank you. Are that all your questions?
Yes, that's my question.
Yes. Can we be on to our respected elder and the former Senate President of the Federal Republic of Nigeria, David Mark? Please, sir, over to you. Over to our former Senate President, David Mark, sir. Sir, you are
Good
on.
afternoon. Good afternoon, ladies and gentlemen.
Good afternoon, sir.
Let me quickly make this point of correction. Just by his own name, it's a mistaken identity. I'm David Oludaremark,
Okay,
not the former senator.
Okay, that's good. That's very important to note. Thank you. Okay, carry on, David.
Thank you.
I
I want to congratulate the Honorable Minister for this webinar that has been organized by you. And it's been so good that we listen to all the speakers and what they have to say. To the Honorable Minister, please, ma, how often are we going to be having this sort of webinar since it's health-based and the aged has been sidelined for a long time? How are you going to collaborate and partner with other stakeholders in the aging industry? Thank you.
Rabi, please. Rabi Abdallah, NTA. Rabi Abdallah, are you on?
Yes, I'm on.
Okay.
Hello, everyone.
Hello.
Yeah, my question has to do with the ozone therapy. You know, I joined in the course of that particular presentation. I'm just wondering, in view of the safety, the non-side effect aspect of it that was highlighted by the speaker, won't it be appropriate to include it in the treatment protocol for COVID-19? For instance, I want to know if there's any similarity between it and the use of ventilators. And of course, I equally want to know if it can actually be adopted and included beyond treatment for COVID-19 and other ailments, especially where older persons are concerned and the generality of the Nigerian populace. Thank you.
Thank you very much. Can we be on to Omokaro, please?
Thank you very much, moderator, and I thank all the presenters. It's really been very enlightening. I want to draw our attention within the context of the team to the health-seeking behavior of older persons, especially knowing that older persons are in the rural area.
Correct.
Rural areas. Research has shown that indeed, older persons patronize, the patronage of hospitals, clinics, and health centers, whether it's government or private, is very low. They rather prefer to present illnesses in chemist or drugstores. And then they also prefer to patronize traditional medical or herbal practitioners. So talking about the comorbidities and listening to the pharmaceutical care by the resource person, how do we ensure the safety of medication in the rural areas? And also we know, of course, and the stereotypes about even traditional medicine. And we know that, I don't know if there is really any regulation to evaluate how toxic it is. So if we're now talking about pharmaceutical care and the safety of our older persons, what regulations, how do we reach them in the rural areas? What kind of capacity can we build? How do we ensure that what they are taking is safe? And how do we ensure that traditional practitioners are licensed? I think it's a lot to build. So that's my question and that's my concern. Thank you.
Thank you very much. Thank you very much. presenters to answer the questions. Let me start with Dr. John. Can you talk about the supplement as asked by one of the speakers? Dr. John, we are not going to take long. We are going to be, because time is fast spent. Dr. John, are you there? Can we bring in Dr. Kojo?
Yes, I'm here. Dr. Kiru is here. Dr. Kojo Kiru
John
is here.
is not there. Dr.
Yes.
Kojo.
Yes, I note the question.
Dr. Kojo.
I note the question of the supplements.
Yes.
But what I want everybody to understand, the reason why they are put down as supplements is because they are not medicines manufactured. They are extracts from natural plants and foods. So we get the full benefit, of the natural product. So supplements are basically, for instance, I will give you, if you take ferrous gluconate, that's organic, and that could be a supplement. But then if it's ferrous sulfate, it's a completely different ballgame. And ferrous sulfate is not easily metabolized by the human body. So we have the same thing with folates and folic acid. So supplements are natural food. So we're talking about the same thing. It's just like we're talking about zinc. We use zinc gluconate rather than inorganic zinc. Because of its safety and and whether how we can use it for COVID-19. Yes, there is a lot of protocol over using any type of therapy for any disease, especially these new emerging diseases. I started using these therapies in Ebola, and we had tremendous success. And the fact that I am still alive is one of those successes. And the fact that none of my staff got ill during Ebola, and we were dealing directly with medical staff who came down with Ebola, that's another evidence. As I said before, medicine is evidence-based. So the evidence we have now with COVID-19, we've been at it for the past almost for the past 3 months, and not one of us have come down. And we know, we are sure, we tested. We've been seeing patients with COVID, and we've been having tremendous success with the new protocols of ozonotherapy that we have developed. And it is left for our people to open their arms. I agree with you 100%, because there is no harm in trying something that does not have a side effect. It has no known side effect, and with such very low toxicity. And the reason why we have to go for trials, etc., is because of those things, those side effects, harmful effects, adverse effects. But oxygen and its species have no harmful effect to the human being, except, of course, if we overuse, the concern, normal concentrations, it should have cause no problems. Now, the hang-up that medical practice is having is that we are all scared of what has been written down, that ozone is toxic. Let us erase that from our minds. Ozone is not a toxin. Ozone destroys toxins. Ozone disintegrates toxins. There is absolutely no truth in that adage that ozone is toxic. And as as for its use in other conditions, definitely, as I said, I used it in Ebola. We're using it for everything that affects the human being, because what it does is it goes and returns it turns on the engine inside the cell and returns the cellular energy. And the dysmetabolism that was happening within the cell that caused the disease, the dysmetabolism goes back to normal metabolism. And that's how healing takes place. And I want this general public to, I know you know this already, that only the body can heal itself. Only the body can heal itself. And what we're doing with oxygen and ozone is to push the body to do what it needs to do. Thank you.
Kojo, Dr. Kojo, yeah, you may need to take up the one of the, hello, the one of the difference between ozone therapy and ventilator.
Oh,
okay.
Ozone therapy and ventilator. Sorry, I overlooked that. Now, the ventilator is just a mechanical equipment to push in the gas. And the gas that we use normally is oxygen. We push in the gas into a non-performing lung, or a lung that is tired, a lung that, you know, the patient is failing to breathe, so you want to ventilate. But the way we are using ozone in COVID is very, very clever. Now we are bypassing the lungs. You know, we bypass the lungs in a COVID patient with severe pulmonary dysfunction. We bypass the lungs by going direct IV, and we supply the body. But now what we are giving is not just pure O3. It is 97% pure oxygen and just 3% ozone. Now, what we succeed in doing by going direct IV is to directly and change the internal environment from a level of hypoxia, because all the tissues are hypoxic when it comes to you know, the serious condition that COVID impacts on the human body. So we bypass the lungs and we do that. But then there is another aspect that, as I said, that we have included 6 years ago in the world of ozone. That is the inhalation therapy. It is very important to destroy the virus on the body surface and in the respiratory passages. Because when you destroy the virus on the body surface and the respiratory passages, there is nothing else to spread. When the patient coughs, there is no virus in the cough because it has been inactivated or completely neutralized. Note that I'm not saying that the virus is being killed, because you can only kill something that has life. The virus is not a living structure. Thank you.
Hello, Honorable Minister, sir. Are you with us?
I am.
Yes, sir.
I'm very much with you, and let me, of course, I've stayed on throughout the program. Let me
thank you, sir.
Commend all the guest speakers that have made input, and they have done very well, brilliantly presented papers. And I want to thank all the participants. I'm not moving a boot of thanks, but I just need to say this. It's been quite exciting. And when I had David Oludare Mark, so initially you said David Mark, who incidentally was the Senate president when I was in Senate. I was so excited. Well, despite not being the David Mark I was expecting, still excited with Oludare. And he asked a question, sustain this engagement. I can assure you, David Oludare Mark, that this engagement will be sustained because we're in the age of a new normal, in which case we can do things even better than before. And we need to share knowledge. We need to share experience. And I have been thrilled, even from what I heard from Dr. Keru, in terms of the role of ozone therapy, particularly as Rabbi Abdallah, we want to know. For me, it was like asking whether ozone therapy can replace ventilator. And of course, Dr. Keru has answered that question very well. But the point must be made. We should not put our hope in ventilator. The goal should be not to get a patient to get to the level of requiring the ventilator. The goal should be to, just nip it in the bud, because the use of ventilator itself is an invasive procedure. And you don't want to put a patient as much as possible through any invasive procedure. So that is why you need to continue to measure, very, very diligently, the oxygen saturation in the blood system, so that you try to do what you need to do. You can still deliver oxygen through oxygen concentrator without necessarily having to, go to the level of using a ventilator, which is quite invasive, and you can count how many patients usually survive at the end of the day when you have placed them on the ventilator. I also want to appreciate the intervention of Dr. Gugwa in terms of the need to carefully manage geriatric patients because of so many things. At that age, the functions of the various organs of the body have diminished, largely and generally. So as much as possible, as she said, you want to focus more on non-pharmaceutical interventions as much as possible. You want to, in terms of nutrition, build nutrition up, expose them to, even some mild exercises and all that, anything that can help the system without necessarily overloading, again, quote unquote, overloading the system with the medications and all that. And this is very, very important. And of course, it's important to let people know, except that we're in a period that we don't want that close interaction, as it were, with the older persons. But you need to have a way of keeping them lively in terms of engagement, being there to discuss. All these things help in a long way, the spirit, as it were, of the older persons. And I think we need to do a lot of that. I want to thank all of you that have been able to participate in this, and I can assure you we will sustain it. Zainab, you have a duty, you have a job to do, which is to sustain this, and of course encourage as much as possible all our herbal practitioners, complementary and alternative medicine practitioners, so that we can continue to share knowledge, because whether we like it or not, the bulk of our people, not just in the villages alone, even in the cities, they still patronize, because it's almost the first port of call, and they patronize this complementary and alternative practices of healthcare delivery. We need it. It's part and parcel of the system. We only need to refine where the need arises, refine it, and make it more measurable in terms of totality of what we do. Thank you very much.
Thank you very much, Honorable Minister. We really appreciate your intervention. Let's look at how do we ensure the safety of older people in the rural areas. Pharmacist Osinobu, can you do that? That's your question. Over to you.
In rural areas, there are so there are primary healthcare centers in the rural areas. And so I think the effort will be more from the center, from the urban areas, like the hospitals. There has to be a link to the rural areas, and the health professionals there, they have to be more sensitized, especially especially the people that are in charge of these counseling. So I think that work will be done by the primary healthcare workers in rural areas.
What Dr. Eme was emphasizing on was, because of the pharmaceutical care, because in the rural areas, we only have patent stores where they can easily go and buy without even visiting the centers. Yes. So she's trying to say, how do you ensure the safety?
I think we also need to reach out to these people because they are everywhere, all over. I know the pharmacists will have some initiatives like that, where we go into the rural areas, talk to these patent medicine vendors, we try to bring them close and explain, because whether we like it or not, they are there and people patronize them. So we need to educate them, and from there they can also pass this information on to the older persons that visit them.
Thank you. Thank you very much, Pharmacist Osinibu. We are going to take another round. I can see 4 hands off. Can I be on to Akin? Akin, are you on? Mr. Akin, that's all. There is no full name, only Mr. Akin. Okay, can we be on to the former Minister for Women Affairs, Josephine Aneni?
Yes,
please,
thank you very much.
You are on.
Thank you very much, Pharmacist Zainab. Thank you very much, everybody. I don't know whether this question has been asked because my internet has been very unsteady, but I have a concern that I had posted on, and that is how we, the elderly people, are being exploited because we don't want to age very fast. So all sorts of people are bringing all sorts of things to us, and they are very, very expensive. How do we regulate it? Because I see it as exploitative. These people are just businessmen. They want to make profits, and they're just loading elderly people with all sorts of supplements and products, claiming that they will make you young, claiming that they will cure all manner of diseases, claiming that you don't even need to go take what your doctor has given you because these ones are cure-all for everything. How will the ministry, the government, help us to regulate it?
Very much, Ma, for that question. Who will take it? Can I call Dr. John?
Yes.
Okay, well, Dr. John, you heard what former Honorable Minister said. So go straight and give up.
Okay. There is this statement
there is no single standalone, single bullet drug for any disease. Treatment. Introduction. I said in integrative medicine, what we do, you have to detox the body first, because before disease came in, it means that the body was accumulating with the toxins, the pH which the body, the cell needs to function optimally. We've been told in this condition is acidic. So that's why you have to do detoxification. After detoxification, then you want to get the cell membrane back to where it was. Most of these diseases, including diabetes, it could be that the insulin receptors have been damaged. They are not able to transport insulin again, across the membrane. So you have to do what you call cell membrane stabilization. That is why omega-3 comes in, because the larger composition of the cell membrane is the fatty acid, the omega-3, the alpha lipoic acid.
Hello, Dr. John.
Yes. The alpha all those. So you need to do that. And then after that, you have to do nutritional supplementation. And in disease.
I'm sorry, Dr. John, you are not answering my question. I'm saying that marketers, a lot of them are selling a lot of things to elderly people, and we don't know their efficacy.
Can I make comment on this?
Yes, we don't know the efficacy, and I think they should be regulated, because we are vulnerable, we are being exploited.
Can I make comment on this, madam?
There is no doubt about that. I agree, but that's why you have to go to professionals. That's why you have to.
It's not fully rude.
Madam, can I make comment on
I
this?
have not finished. So what I'm saying is that, Mrs. Anene, it is very important you go to professionals. You don't just go to quacks that they don't know what they are doing. Professionals will take you through and then take you to where you need to be. As I've outlined, if you came to an integrative medicine practitioner, these are the standards. And these are also a group of, medical doctors. They know what we're doing. Like if you came to our center, we're not going to start you with anything until we do laboratory tests to establish the baseline of where you are. Then it is after that, as we're treating you along,
You're still not answering my question.
Parameters are actually changing. So you need to go to professionals.
Thank you. Thank you, Dr. John. You still not answered my question. I'm not talking about you professionals.
Hello.
I'm talking about women and men who want to make money.
Well,
thank you. Can I say something briefly? Yeah,
yes.
Let me intervene in this. Thank you, former minister, for your question. Very apt. What is important, I agree with you, because Nigerians are very vulnerable to businesses that people say, you find them, they bring products, and when they bring these products into this country, they ask you to buy, and then they ask you to invite people, and then you find that a lot of people are being exploited. So what is important, you find that, for example, I always complain too, during the time of Tianxi, they will say one person will sell the Tianxi, give it to another. Strategy they used to get, and they said they'll give you a car, they'll give you something unique, you travel abroad. All this is the excitement that Nigerians see. And then they bring products, speak all the grammar, and want to exploit people. But what is important now, like we have said, NAFDAC is looking at that intervention and deliberately not wanting at times to register those products that are imported. Rather, we are looking at our own inwards, because tomorrow I will talk about the herbal medicines that are right for our people based on scientific evidences. And then also we are going to talk about traditional foods. Like I said, we must be very practical. We'll talk about our foods that will give the elderly good quality of life, and also specific supplements, which we all know. For example, like we have talked about the cod liver oil, vitamin C. These are things that we can have them in rich foods and we can have them in supplements. So it's an opportunity for us to tell you, when those people come to you telling you very expensive, we can see them. Some go as far as 100,000. You should not be allowed to be exploited. Because if you look at our people have been there and have lived for so many years. Our elders were there for so many years because they were doing something within their domain, exercise, going to farm, natural foods. We are going to talk about having a garden behind your house so that you can have these simple natural foods and then avoid this exploitation. Nigerians want to hear that they will be given a car or they will travel. I think this is the time. We are not going to do that, and we are going to, that is the importance of this advocacy. I'm sure, Minister, maybe I've been able to answer your question to some extent.
Yes, thank you, my general, thank you.
Zainab, hello? 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 Hello?
Hello? We have to quickly round this program. It's supposed to be 2 hours program, and tomorrow we are going to have another one. So we are going to be fast. Can I call Hafsat Adeshina? 2 minutes. Are you on?
I'm on, ma'am.
Hafsat Adeshina.
I'm on, ma'am. Good afternoon, and very good, yes, very good presentation. My own question is in the area of intravenous nutrition. Is the ministry looking into production of local intravenous nutrition? We know all these come, Dr. John spoke about intravenous nutrition. All these come imported that we buy, and they are not very stable. Is the ministry looking into this production for the elderly? Thank you, ma'am.
Thank you. That's a good one. Can we have Adewale Afonja Ibrahim? 2 minutes, straight to the point. Adewale Afonja. Adewale Afonja. Are you on? Okay, can we go to Iyobosa Omoregbe? Forgive me.
Yes, thank you for, I will be very brief and straight to the point. Currently, there are challenges in the traditional and complementary medicine in Nigeria, especially in the area of clinical trials and research. And this is a fact. This practice is individual or consumer driven. Now, the question is this: how can we crowdsource data from patients, caregivers, especially for the development of this traditional complementary applied medicine? Because if they have the information, crowdsourcing information for clinical research and trial, that is the reason why the medicine, the practice has not been fully developed. Our herbs have not undergone the advanced development as in China and India.
Thank you, Mr. Ayobese. I'm sure you are behind time. A lot has been done. My minister said it. We need to know, as I'm telling you, our bill, the traditional medicine complementary bill, will soon be passed by the Executive Council, which will be taken to the National Assembly for approval. Just like there must be control and there must be regulation. And it is important, just like we have other councils, we must also have councils for traditional medicine. The ministry has done a work, expect that. And I want to tell you another thing. The ministry has also approved a committee that will look into the implementation of the Institute of Traditional and Complementary Medicine. Furthermore, a lot of research, especially with COVID-19, all the practitioners that came, when we talk, especially with the Orthodox, we tend to look and say we know all, and we look at the traditionals, they don't know anything. If you look at them, they don't know anything, you are fighting God. But we need to look at them and have that synergy. They have the product, they have the knowledge, which I call traditional science knowledge, then you have the modern science knowledge. So we need to bring this together for the benefit of our people. Look, Minister said it has, because of COVID-19 now, we must look inwards. Every day we criticize our people. We criticize the traditional medicine practitioner. We say they don't know what they are doing. Where will you know what they are doing if you are not interested? So it is an opportunity. We must learn from them, and also they must learn from us. We need to have this science, and we are doing on, the NAFDAC is doing a lot in evaluating the traditional medicine products that has so far been submitted for safety. And we have also looked at the NIPRID Institute to commence some clinical trials on some herbal products. We realize that in Nigeria, we have not done that. We will be calling the Chinese, we'll be calling the Indians. Meanwhile, we have so many plant species in this country. So please, there is advancement. The ministry has even developed what we call a pharmacopoeia, a document on herbal medicine. We have a committee, expert committee on complementary and alternative medicine. So a lot of steps have been taken. We must follow protocol, and we need to establish so that our products too can meet international standards. I must tell you, they are looking for Nigerian plants outside. I didn't want to say much, but I discovered that we are talking traditional medicine. They don't know what they are doing. What are we doing? Ministry is doing a lot. And that is why we organize such program now. Why are you on? You are on with us. And tomorrow you hear more. Thank you very much. I just felt I should. Are you happy? Thank you. So let's
yes.
Are you happy?
Yes.
Thank you, Mr. Hiyabosa. Thank you. Thank you. So can we have to round up within the next 10 minutes. My minister has been there patiently waiting. Honorable Minister, sir, over to you, your comments, sir.
Madam Zena, once again, thank you very much. And of course, thank you to all the participants. Just something to add to the reaction or the answer to the query, as it were, raised by Madam Josephine Aneni. I think the first thing to say is that all of us as individuals must take primary responsibility for our health. That is the first thing. It is true, as she said, there are people, and she described them as marketers. Marketers will naturally market their wares. It doesn't matter. They can, and in marketing their wares, they can lay claims to anything. So it is we as individuals that must be careful. And what do you do, particularly for the aged? First thing is to ask questions. Ask questions. And of course, seek the truth. Even the Bible says, ye shall know the truth, and the truth shall set you free. So, if somebody brings a product and makes claims, you have access to your doctor, you have access to pharmacists, you have access to other people who can be of help. So you need to consult them to find out that due, so that you can be educated as to that function of that drug or product, so that you don't get railroaded or stampeded because of economic gains of the marketers. So you have a duty to yourself by seeking to know what exactly before you decide to buy, so that you are not taken advantage of. I think that's a critical thing that I needed to stress on your question. Thank you very much.
Honorable Minister, sir, we are going to round up within the next 10 minutes. Can Baba Omo is Baba Omo there? One of the greatest traditional medicine practitioners in Nigeria. Can we have you with your few comments? Are you on?
I am on, madam.
Okay, sir. Over to you. 2 minutes. Because you go talk story.
Yes. Well, I have to thank you, Madam Pharmacist Agia Zainab Sherif, and Mrs. Aneni, who made it possible for me to be connected to this very all-important discussion. First of all, when we are talking of the aged, was it not immune that was sufficient, which the old man generated by the food he eat and by the environment he made use of, that made him to live a long life? Now, all those things that he was eating, are they destroyed? They are still available. Now, and they will be useful to the coming generation. We are ready to give it to the coming generation. This COVID-19, we have a lot to produce. We have a lot to produce for them so that Nigeria will not become a wait and look and see what is happening. We will bring out our heads. And the governor, the minister who like things that are produced in Nigeria will be very happy that this is happening in his time. We are not going to, we should have done much, but because of the interstate lock jam, that is why we were not able to do much. Now that we are, a dimension is coming up through such connections by the development of technology. I'm happy that we will do much in Nigeria. Thank you very much, madam.
Thank you, thank you, thank you. You can listen to words of wisdom. He said we have it, and we grow it, and we can eat it. Prof, we want to know how old are you? Prof.
I am 76.
You are what?
I'm 76.
Thank you very much. Thank
yeah.
You.
Yeah, we have some
listen.
comment in the chat.
Comments.
Yeah, one of the comments say, kudos to Federal Ministry of Health for recognizing the aged. Another, I will talk to you more, that's your swing and any. Another say, I'm concerned about the current trade of pyramid marketers selling all sorts of expensive supplement. And again, that is former minister. Then another say, good moderation, General Zainab. To use the words of Honorable Minister, we appreciate you, ma'am, with your contribution to traditional medicine in Nigeria. Wonderful education on ozone. Then, let me take this lastly, because there are many. Would be good to consider the inclusion of ozone therapy in the treatment protocol for COVID-19 and in the management of other diseases. Let's stop here because of time factor.
Thank you very much, Freeman, for that. As we conclude, I want to appreciate our excellent participants. You are not there, but we give you, we are clapping for you for your participation and be the patience of listening. Wonderful speakers. I want to thank Dr. Kojo all the way from Sierra Leone, pharmacist Asunubi, and then of course, no other person also, Dr. John, for your presentation. And comments, I appreciate all the comments, because without the comments, we wouldn't know if there is a clearer understanding of the subject. And I really need to appreciate my Honorable Minister of State for Health for waiting and following and also participating actively saying both the role of what the ministry is doing and his comments. I thank you, this wonderful audience, and we pray that tomorrow, don't forget, the same time tomorrow, there is more food for you to eat from listening to us. Thank you, and God bless you all. Bye-bye. Thank you.
Thank you very much, Ajia.
Bye-bye.
Well done.
Thank you. Bye-bye.
Bye-bye.
Bye-bye. Bye-bye.
Make you
Thank you. Thank you. Thank you.
Spotlight the important.
Ah, Didi!
Yes,
are you there?
Yes,
Thank
I'm
you.
there.
Good to see you. Thank you. All the Didi. Thank you.
Oh, cinema. Oh, no.
Thank you.
Yes, one.
Okay, bye.
Woman is also one of them. Woman is also one of them. Even the one go, but survive.
Bye bye.
Answer,